CPT JJ-CPB Introduction, page 15, part 15.
Time continued.
Time continue. When codes are ranked in sequential typical times and the actual time is between two typical times, the code with the typical time closest to the actual time is used. For example, if a consultation, if it's detailed, takes 30 minutes. If it's light, if it's not that detailed, takes 15 minutes, right? 15 is light. 30 if it's detailed. And the actual consultation took 29 minutes. So 29 minutes is closer to 30 than to 15. So you take it at the one that is closest. So you take 30. You don't take 15 because it's too far away. You take the one that is closest to the real time that was spent. That's what he's saying, right? And this is usually works for evaluation and management, right? Services guidelines. And that's why we have a little reminder of what is an EM service, right? In an EM service is like a consultation with a doctor, right? Or a visit to the doctor where the history, the physical examination, and a medical decision making are the three main components. All right, so that's our theory for today. Now let's do a problem. Ready, set, go. All right, the code is CPT JJ-RVA, page 266, exercise 131, and this is a level 2 exercise, and the title is
Stereotactic radiosurgery.
Stereotactic radiosurgery. And the text reads,
Surgery, nervous system. Patient has metastatic brain lesions.
Metastatic brain lesions means brain lesions that have traveled, right, from the original site.
Right.
And
patient undergoes stereotactic radiosurgery, gamma knife of 2 lesions.
A stereotactic radiosurgery, gamma knife of 2 lesions, okay? So that's the procedure. Now we're going to count to 3 so you can pause the video and give us the CPT code for this procedure. 1, 2, 3. All right. The answer is 2 codes. The first code is
61796.
And the second code is
61797.
You got that? You got the 2 codes? If you did, congratulations. If you didn't get it, let's give you a couple of tips. Okay, the first tip.
First one is a level 2 difficulty. There are 2 codes.
Right, we consider this a little difficult because there are 2 codes. Okay, for the first code.
Number 2. For the first code, start with stereotaxis.
Stereotaxis.
Stereotactic is the same word for stereotaxis.
Right, they're the same basic word. So the different. One is an adjective and the other one is a noun, right?
Right.
So okay, but it is the same thing. Okay, now the third tip.
Third tip is gamma knife uses focus beams. Pay attention to 2 lesions.
So you have to be careful that gamma knife is synonymous with focus beams. All right? And you're going to see in the video. And now also pay attention that in the text it says 2 lesions, right? That's important. Okay? Okay, number 4.
Number 4, the second code is an additional code for the first code.
Right. Because of the 2 lesions, you're going to find out that you need an additional code. Okay? So that's our 4th tip. And the 5th tip?
Stereotactic is adjective for stereotaxis.
Is adjective for stereotaxis.
The same wing for number 2, but brainial is in the cranium and it is not complex.
The brain is in the cranium, so if you see cranial, they're talking about something in the brain, right?
Yes.
And it is not complex, right? It has to say complex if you want to choose complex, but since it doesn't say complex, you go by the default. That is, what is the default? Simple, right?
Right.
All right. Now we're going to watch a video to see what the gamma knife stereotactic radiosurgery is, right?
Right.
Okay, right.
The gamma knife, also called stereotactic radiosurgery, is a type of radiation treatment used commonly for brain tumors. It may also be used for other abnormal conditions of the head. The gamma knife is a non-invasive surgical procedure that doesn't require incisions, which are cuts through the skin. Instead, a machine precisely focuses and delivers about 200 beams of radiation onto a target area inside the head. The radiation only kills abnormal cells, while sparing the normal tissue around them. The gamma knife treats small brain tumors, blood vessel malformations, and nerve conditions that are hard to reach or too risky to treat in other ways. The gamma knife head frame has 4 pins or screws. After numbing the scalp, the doctor will attach the head frame with the screws. The frame prevents the head movement and helps guide the radiation beams. With the head frame in place, an imaging study, such as an MRI or CT scan, will be done to determine the exact size, shape, and location of the target to treat. The treatment team will use the imaging studies and advanced software to create a treatment plan. Then the patient will lie down on the gamma knife couch. A radiation helmet will be positioned over the head frame. The helmet contains holes that allow only the programmed radiation from the treatment plan to pass through. With the helmet in place, the couch will slide into the radiation unit. The procedure is silent and painless. It takes a few minutes to an hour or more, depending on the size and shape of the treatment area.
Okay, so
The effects on the tumor occur over a period of time after the procedure.
okay, all right. That's the procedure, all right? The gamma knife stereotactic radiosurgery. Now let's go back to our problem.
Okay.
All right. Okay, so the answer for the problem is 2 codes, 61796 and 61797, and you have read all our tips. So now we're going to count to 3 so you can pause the video and then give us the path, how we got to these 2 codes, right? So 1, 2, 3. All right, this is the summary of the whole problem. It's a surgery section of the CPT code and is a nervous system, and the patient has metastatic brain lesions. Right, brain lesions that have traveled from its original site. The patient undergoes a stereotactic radiosurgery gamma knife of 2 lesions. Remember, 2 lesions, right? So the code 1 through the index is found like this.
First, you go to index.
Go to the index.
Then you start with stereotaxis.
Start with stereotaxis.
Then you go to focus beam.
Focus beam. Remember, we told you that the gamma knife works with focus beams. That's the only thing you need to know for this. And then
Cranial.
go to the cranial because the brain is in the cranial, right?
Right.
So
Then you go to 61796 through 61799.
okay, so we have all those codes, right? Now, we could go one by one, but if you go to the first one and you find everything that you need on the first one, you can stop there. If you want, you can go to the other ones, but there's a reason why the other ones are not used. So we're just gonna save a little time and just examine the first one, right? So the code 1 through the tabular is found like this.
First, you go to tabular.
Uh-huh.
Then you start with this code 61796.
Right. And what is that?
Stereotactic radiosurgery,
Right.
gamma ray, 1 simple cranial lesion.
Okay. Now, it says one simple cranial lesion, right? So this is 2 lesions. So for a second lesion, you just gotta find out, if you go just underneath the code, you're gonna find out the code for the second lesion, right? So the code number 2 is found like this.
First, you go to tabular.
You're in tabular already with the first one, right? And then?
Right, and for the second one, you go back to 61796.
Right, you're looking at that code, and then if you go below one line, what do you find?
61797.
What does it say?
It says each additional.
Each additional lesion, right?
Right.
And then so we have one more lesion because we have 2 lesions, so we have to use this code too, right? 61797, right?
Yes.
Because the 61796 only represents the first lesion. The 61797 is the second lesion, all right? So that's why we need 2 codes, and that's why the answer is these 2, right?
Yeah.
61796 and 61797. Okay, thanks for watching, and don't forget to visit our website and also
And also you can subscribe to us in YouTube by clicking here for our new medical coding videos.
Okay. You will get?
You will get up to 3 videos every day that we make. ICD-10, CPTs, all that's needed to pass the medical coding certification exams.
So don't forget to visit our website and subscribe to our videos. Thank you.
Goodbye.
Bye.